mode.
Hello, and welcome to the County Health Rankings and Roadmaps 101 webinar with a tour of our website. My name is Ali Havrilla, and I'm a community coach with County Health Rankings and Roadmaps. And I'm joined by my colleagues, Karen Odegaard.
Hello.
And Erica Burrows-Girardi.
Hello, how are you?
And as we go through this presentation, we'll be taking turns answering your questions as well as sending out links via the chat box. First, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. County Health Rankings and Roadmaps is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. We would also like to acknowledge that this program is the result of the contributions of many partners, including those listed here. Today, we'll cover an overview of County Health Rankings and Roadmaps, provide a live tour of our website, demonstrate how you can access additional tools and resources, and spend a little bit of time answering your questions. We want to start today with a guiding question. How can County Health Rankings and Roadmaps help you build a culture of health? The Robert Wood Johnson Foundation has laid out a powerful vision for building a culture of health in every community in the country. That vision includes the belief that all individuals and families should have the means and the opportunity to make choices that lead to healthy lifestyles, regardless of where they live. Not long ago, America viewed health as the doctor's office, isolated from daily life. But today, we know better, and research gives us a better understanding of how interconnected health is with income, education, housing, and a myriad of other factors. There's a tremendous need to shift from the old lens of working in silos, as we are finding only a cross-sector approach can fully address these intertwined and complex issues. Each one of us is a piece of the puzzle of building a culture of health. The hope and vision of a culture of health has to be shared. The circle of engagement needs to extend to the whole community. The truth is, everyone has a stake in the health of the community, from families to schools to business. In the same way, the County Health Rankings and Roadmaps program is made up of many components that work together with a common purpose, to build a culture of health, county by county. We want to start today discussing why this work is important. Another way to think about a culture of health is where everyone in a community has equal opportunity to enjoy good health. In other words, health equity. You may be asking, how can we assure that our work is creating health for all? How can we move beyond a health equity lens to applying health equity as a strategy? What does health equity really mean within building a culture of health? It means creating a sense of community where all individuals, especially those most affected by poor health outcomes, feel they have a voice and a role to play in creating and implementing solutions. Healthy People 2020 states, achieving health equity requires valuing everyone equally, with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. Let's take a moment to break this down with some examples of policies that have led to current inequities. Here in a few minutes, when we review the rankings model, you will notice that housing and transit is included as a focus area. Why is this relevant? Access to affordable housing is key to good health. Generations ago, President Franklin Roosevelt's New Deal, the federal government started subsidizing a lot of housing. But they funded programs that allowed whites to move into new suburbs like Levittown, New York, while the options for people of color were public housing apartments in the same city centers where they already lived. Over the generations, the suburban homes greatly increased in value, creating wealth for the white families there. Meanwhile, even though laws have changed allowing people of color to have the right to buy into places like Levittown, many of these homes are now selling for $500,000, out of the range for many people. For our second example, we'll explore the wage gap between men and women. With a history of women being excluded in the workplace and women's jobs being differently valued than men's, there are long-standing income disparities between women and men. This image from 2012 shows women earning 77 cents for every dollar men earn. And as of 2015, women still make only 79 cents for every dollar men earn. This gap has a significant impact on families. As you reflect on your work, we invite you to consider how you might work with those who are the most vulnerable to identify what changes are needed to improve health outcomes in their communities, and help them find data and solutions they need to make their case to policymakers. I encourage you to check out the links that were just shared to the Health Gaps report and the RWJF site with information, tools, and inspiring stories on how to truly address health inequity. So now that we've discussed why this work is important, let's review the county health rankings. And as we share the various components that make up county health rankings and roadmaps, I would invite you to think about which piece or pieces of the program you can use. So this slide shows the thinking behind the rankings, our theory of change about how the rankings can be a catalyst for action that improves the health of everyone in a community. Starting on the left, we take population-based data that is collected by others, and we utilize this data to create an easy-to-use snapshot that compares counties within states and is released every spring. But we produce the rankings for a reason, because they get the attention of media and can be used to start and broaden conversations about health in communities. Those conversations can then lead to broad community engagement and multi-sector partnerships that can in turn select and implement evidence-informed strategies to address community priority areas, and finally, in the long run, improve health outcomes. So essentially, the county health rankings aren't about numbers. They're all about a call to action. We also know that while simple in theory, putting this model into practice is challenging. So we provide tools and resources to assist communities in each area, and we'll talk more about those, starting with the rankings. The County Health Rankings ranks the health of nearly every county in every state. For each county, you will find two rankings, one for health outcomes in green, which reflects your county's current health or today's health, and one for health factors in blue, which reflects how healthy a county might be in the future based on the many factors that influence health. Another way to think about this is tomorrow's health. The rankings model on the left side of the screen is one of the most important images we'll share with you today because it shows what we use to determine the county health rankings and what influences health in a community. The model shows the relationship between policy, health factors, and health outcomes. The rankings make it clear that good health includes many factors beyond medical care, including housing, education, jobs, access to healthy food, and more. It shows us that all these factors impact how well and how long we live. So now, starting from the bottom, we know from research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors, the blue boxes, shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes, the green boxes at the top, to show how healthy each county is, length of life and quality of life. As an example, expanding early childhood education improves academic achievement. Higher levels of education lead to higher levels of income, which then influence other health factors such as access to healthy foods, clinical care, and quality housing, which in turn influences health outcomes. In a few minutes, Karen will do a web tour and she will show you more about the rankings, how to find the snapshot of health data for your county, and how to utilize the data. Now we'll continue with our overview. Our next stop is Roadmaps to Health, the how-to of county health rankings and roadmaps. Right now, you're looking at a screenshot of our Action Center. The Action Center includes people, tools, and practical resources to guide communities as they build healthy places for all to live, learn, work, and play. As we continue to explore the how-to of county health rankings and roadmaps, I want to share with you the Take Action Cycle. The Take Action Cycle, as you can see on the screen, and all of its resources provide step-by-step guidance to support your work. Communities can and are improving health by using the steps of the cycle. Let's take a second to walk through the steps of the Take Action Cycle, starting at the top right. So first, gather information to assess needs and resources. Then, set priorities so you can focus on what's important. Find the most effective approaches for your community to address your priorities, and then get to work on acting on what's important. And of course, evaluating throughout the cycle will help you improve strategies and ensure that what you're doing is effective. You'll see that communicate and work together sit outside the cycle because working together and communicating with partners, policymakers, and your community is continuous throughout all the steps. At the heart of the Take Action cycle is people working together because we know solving issues like childhood obesity, poor high school graduation rates, or crime and recidivism require the wisdom and resources of everyone in the community. I wanted to take a second and highlight What Works for Health, which provides communities with information to help select and implement evidence-informed policies, programs, and systems changes that will improve the variety of factors we know affect health. It is found online in the Roadmaps to Health section of our webpage, and Karen will show you how to access it during the live web tour. Many communities who are working in the choose step of the action cycle use What Works for Health, but it can also help you assess current strategies and better understand expected outcomes when you're taking action. One of the things that I really like about What Works for Health is that it provides an easy-to-use, searchable menu to help you look for evidence-informed policies and programs and for the specific problem you're addressing. It's an all-in-one place where you can find evidence ratings, literature summaries, and implementation examples for almost 400 strategies. When I introduced the Action Center a couple of slides ago, I mentioned that it includes people. We have 11 coaches across the country who can provide consultation, link you to resources, and help build your capacity to improve the health of your community, at no cost to you thanks to the support from the Robert Wood Johnson Foundation. Roadmaps to Health Coaching offers community leaders the opportunity to strengthen and rejuvenate multi-sector partnerships so they are better poised to advance work that builds a culture of health, enhance community capacity, build direction, alignment, and commitment to implement and sustain specific strategies to enhance health outcomes, and connect with other community leaders or national experts who are tackling similar challenges in building a culture of health. You can connect with a community coach by clicking on the Get Help button located throughout our website. We have heard from communities that coaching provides some of the following benefits. It brings us together and keeps us moving. Coaching provides an opportunity to sift through the noise and chatter to develop strategic focus. It helps establish accountable goals and actions and increases local capacity for change, learning, improvement, and innovation. Before Karen begins the web tour, I wanted to highlight a couple of key takeaways. So far, we have discussed why this work is important, reviewed the rankings model that shows what we use to determine the county health rankings and what influences health in a community, and we touched on Roadmaps to Health, which is the how-to of county health rankings and roadmaps. Let's take a second to tie together the why, what, and how of county health rankings and roadmaps. It takes everyone, all of us working together to improve the health of a community. We need to move as quickly as possible from data to action, not get stuck in analysis paralysis or drowning in data. We encourage communities to look to the evidence to inform these actions, and if you innovate, be sure to evaluate. Keep focused across the health factors, including social and economic factors. Prioritize your efforts to focus on creating better opportunities for health of all community members. And don't be afraid to take on policy, systems, and environmental change, which will in the long run create the greatest long-term change in health for the children and adults in your community. Having walked through the overview of county health rankings and roadmaps, now Karen's going to take you on a brief tour of our website. I'm going to turn it over to her, and she's going to show you where you can find some tools and resources to support your work.
Great. Thank you so much, Allie. And we're just going to shift presenters here and get started. Okay. All right. So we are going to start by taking a look at countyhealthrankings.org homepage. And what we're going to do in this portion of the presentation is I'm going to give you some tips on how to navigate around the site, where you can find different tools and resources. And then we're also going to walk through how a community might use these tools and resources to support their improvement efforts. So starting at the top, the first thing I want you to notice is that there's this logo up here, our County Health Rankings and Roadmaps logo. And no matter where you are on our site, you can always click on that logo and it'll bring you back to our homepage. So if you get deep into it, you can always come back up to the top and click on that to bring you back to the homepage. The next thing I want to go through with you is the orange navigation bar. This bar is, it will also stay with you throughout your visit to countyhealthrankings.org. And it's a really great way that you can navigate around pretty much the whole site with just a few clicks. So we're going to quickly walk through that to give you sort of the lay of the land for our homepage. The first tab, Health Rankings, provides information about our approach, the rankings methods, and tools to help you understand and use your data. And moving to the right, the Roadmaps to Health section, again, is that area that's all about the how-to. So this is where you're going to find the Roadmaps to Health Action Center, what works for health. You can also view stories of communities taking action, and you'll notice that this is where you can learn a little bit more about whether community coaching might be a good fit for you, if this is something, if your community perhaps needs some guidance or a thought partner as you work to improve health. Under the Resources tab, you'll find reports, including your State Health Gaps Report and the Key Findings Report from the past 3 years. And we'll touch just a little bit more on that Health Gaps Report in a moment. You'll also find information on upcoming and archived webinars and frequently asked questions. And then finally, under More, you'll find a link to our County by County blog, the About page, where you'll find more information about our program, including publications, and a link to information about the RWJF Culture of Health Prize. This includes stories and videos on past prize winners and more about how you can apply for the prize. In the middle of the page, you'll find a map of the United States and a search down here, where you can enter your county or state name. To begin to explore the rankings, I'm going to click on the map. And for the purposes of this demonstration, I'm going to go to Missouri, home of RWJF Culture of Health Prize winner, Kansas City. As we come to our state landing page, you can see two maps. On the left, you see your health outcomes map in green. And on the right, you see your health factors map in blue. Just below the maps is where, again, you can find a link to your State Health Gaps Report. These reports can help you find out what's driving health differences across your state and what can be done to close those gaps. As we continue to move down, you'll find data that you can download for your state and links to more data and community health improvement resources specific to your state. You'll also find stories and context specific for your state. So as I scroll back up, once you come into the state page, you can either select your county from this drop-down menu up here on the right, or by clicking on a county on the map. So I'm going to click into Jackson County. And this is going to bring us to our snapshot, our county snapshot for Jackson County. Now, at the top of the snapshot, you're going to see a number of tabs. These tabs offer a few ways to explore your data. You can use these tabs to dive into the measures a little bit more deeply. You can get to those downloads again for your state, and you can compare multiple counties, including the ability to compare counties across state lines. So let's take a look at this snapshot. Before we jump into the data, it's important to first understand what that data is measuring. What are we looking at here? So in that left column, the first left column that we see here, you'll see each of the 35 measures that we use to calculate a county's rank. And you might wonder, as you look at these measures, what exactly it's looking at. So you can first hover over the measure name to get a short description. of what that measure is looking at. This short description will tell you who's included and what type of data it is. You can also click on the measure name from the snapshot for more detail. So I'm going to click on a measure from the snapshot, and today we're going to look at adult obesity. And this is going to bring us into our measure detail page for adult obesity. The first thing we see here is another map. And this map shows specifically how counties compare based on just the adult obesity measure. So the counties shaded a deeper shade of blue have higher adult obesity, while the counties with fewer obese adults are shaded lighter blue. You'll notice there are some new tabs up here across the top. From these tabs, you can look at detailed data for the measure. You can see the full description, including why we use this measure. You can learn about the data source and begin to browse relevant evidence-informed policies and programs from What Works for Health. On the left side here, you'll see a brief description, a little bit about the rankings methodology, and summary information for this measure. You can also navigate to other measures from here as well using the orange box in the left corner. So now that we have an understanding of what measures we're looking at, let's actually start to take a look at the data. For most counties, we provide county-level data for each of the 35 measures that we use to produce the county rank. You'll see that data in the second column here, right underneath Jackson County in this example. And there are a few things that you can do to better understand what your county's value really means. First, you can compare your county value to the state value. So again, I'm going to stick with adult obesity for this example, where we see that in Jackson County, the adult obesity percentage is 30%. If I look to the right, over here under the Missouri column, I see that the state average is 31%. As you look at how your county compares to the state average, you can think about, are you doing better? Are you doing worse? Are you doing about the same as the state average? You may also want to look at, so say you're doing better than the state average, you may also want to look at the top U.S. performers, which is the next column to the left. The top U.S. performers represent the 90th percentile for the nation, so only 10% of counties have a better value than the one shown in this column. And we include this as an aspirational value. So it can be something to reach for if you're not there quite yet. Finally, for some of our measures, we provide trend graphs. The snapshot is just that. It's a picture of your county's health during a specific point in time. But the trend graphs allow you to see changes that have occurred over time. So if we scan down this column, we'll see that these trend graphs are actually color-coded. I have color-coded icons to help you quickly see whether your county's estimate is increasing, decreasing, or staying the same over time. Red graphs indicate that your county is getting worse for a measure, yellow indicates your county is staying the same, and green indicates that your county is getting better for this measure. And you can click on these icons to see a detailed graph of the trend data. So if we look again at the adult obesity trend graph for Jackson County, we can see the county's trend in blue, the state's trend in green, and the national trend or the United States trend in orange. So we can see, looking at this, that Jackson County is really staying about the same for this measure. I'm going to click out of that. So once you've explored and compared your data, you may have a good sense of what's going well in your county, what areas are in need of, and what areas are in need of more work. But if you're still looking for a little bit of guidance, then you can turn to the areas to explore and areas of strength. So areas to explore highlights potential challenges that a community may want to examine more closely. And this is a feature that you can turn on at the top of your snapshot. And when you do so, you'll see orange boxes highlighting areas to explore based on health factor measures that seem to have the greatest opportunity for improvement. And if we turn on areas of strength, we'll see highlighted in purple areas where a county is doing well relative to either other counties in their state or across the nation. The county snapshot also includes additional measures, which provide some additional data that can be helpful, but is not used to calculate the rankings. You'll notice this year that they are embedded in the snapshot, so you'll find them where these little plus signs are, these little blue plus signs. When you click on that plus sign, you'll see the additional measures in each section. So I can look at the additional measures under quality of life, and I can look at the additional measures under health behaviors, and so on and so forth. In 2016, we added 6 new additional, again, those are not ranked measures, including drug overdose deaths modeled, insufficient sleep, and residential segregation. So once you've taken some time to explore and understand your snapshot data, you may want to dive a little deeper to better understand health in your community. Who in your community is most affected by the factors that contribute to poor health? Who is using tobacco? Who is maybe not succeeding in the education system or is unable to access safe and affordable housing? To help you with this, we've included some tools on our site to help you understand your rankings data and to think about how you can measure your community's progress over time. So I'm going to scroll back up to that orange navigation bar and move us over to take a look at some of those tools. I'm going to use the rankings menu and select using the rankings data. Using the rankings data helps you find and understand the data on our site and beyond as you begin to assess your needs and resources and to focus on what's important. It includes a section on digging deeper, which helps you think through what other information would help you further understand the health differences between subgroups in your community.
And Karen, this is Erica.
Yeah.
We've had several questions that came in about how to dig in a little bit deeper with data. So do you have time to actually just click on that for a second? Let's see what that looks like.
Yeah, sure. Let's take a peek into digging deeper. And I would say all of these sections that are in using the rankings data are incredibly useful. I always encourage communities that are starting to explore their snapshot to spend a little time with using the rankings data. They can be great places to begin to think about how you're going to communicate this with folks and what are the most important takeaways from your data. So looking at digging deeper, we can see that it offers some examples of questions that you might want to ask here. And then it's actually going to let you know on each of our measures whether there's subgroup data available that we aren't using. We use only county level data, but that you may be able to access subgroup level data for each of our measures. So if you look at, let's just keep going with adult obesity. Adult obesity data is available at the subgroup level of age, gender, race, education, income, but not at the sub-county area. And if I click on adult obesity, I'm going to learn a little bit more about that particular measure. You might notice that I've moved into the data source information for adult obesity. So I'm going to see where we're pulling this data from. And then I'll get some guidance on different methods to try to get some more specific data than the county level data. You can also find some more detailed methodological information if you're really interested in that particular data set. So I'm going to back out of that. And you can see that we have, I don't want to just scroll down here, but you can see that we have this information for all of the measures that we've included in the rankings. I think another key thing that goes hand in hand with digging deeper is finding more data, and I'm going to just take a peek in there quick, where you can link into state-specific data sources as well as some national data sources to find some additional, sometimes more finite level or more granular data. Does that help, do you think, Erica?
Yes, considering the questions that came in. Thank you so much.
Okay, great. Before we move out of this section, I want to just also mention Measuring Progress is another really great resource, and this tool can help you understand how to use the measures that are included in the rankings to measure your progress. Where you can look, it also helps you think about where you can look for other data that can help you tell your story and how to tell if your community is poised for progress. So as Allie said, the rankings are only in part about data, really. They are intended to be a call to action. So as we think about how do we move into that, how do we take action based on this data, the Roadmaps to Health section of our site, and specifically the Action Center, are there to help communities move forward and take action based on their data, moving with data, from and with data to action. So I'm going up to that navigation bar again. I'm going to click on Roadmaps to Health, and I'm going to click into the Action Center. And here we see the Take Action cycle that Allie walked us through earlier. This is an interactive cycle, so that's one of the most important things to know, is that this is not a flat graphic. This is interactive. And as you look at it, you can click on any of the steps around the action cycle, as well as the partner guides in the center. From just staying here on the Action Center landing page, you can scroll or move your mouse, hover your mouse over the different steps in the cycle, and you'll see some questions pop up there. These questions can help you understand where you are in the cycle, and it also lets you know a little bit about what kinds of questions you can expect to be answered in that guide for that step. So I want to take a look at one of these guides. We're going to go into Work Together here. And the first thing that we'll see is a brief description of the step, the purpose, and then who to involve. And as you scroll down, you'll see that we've broken each step down into key activities so that you can find the most relevant guidance and tools for your community. When you find an activity that is of interest, you can open it to read the guidance and explore the links to some related tools. So I'm going to actually go into an activity that we added this year, which is working together to address inequities, health inequities. And when we look at an activity, each activity is going to have some guidance for you. And then to the right, you'll find suggested tools. You'll always see up to 5 tools that are visible, but I want to make sure that you notice that sometimes you're going to see this View All Tools option, and clicking on that will display the rest of the tools for that particular activity. So I want to take a look at a tool just so you get a sense of what happens when you click on a tool. You'll come to this page for that tool, where you'll see a brief description. The description includes where that tool can be found in the guidance of the Action Center, and then a link to the actual tool. So this tool is the Action Toolkit to Advance Health Equity, and it comes from the maker of Unnatural Causes. And I'm going to step back and direct you to the fact that throughout the website, and especially throughout the Action Center, you will find this button, this Get Help button. And this little button invites you to contact our team for personalized help, again, at no cost to you, thanks to the support of the Robert Wood Johnson Foundation. Clicking on this Get Help button will take you to an email form that then is distributed to one of our 11 community coaches based around the US. Another way that you can find tools, I'll just point out real quickly, is to search in tools and resources. And you can use a keyword search there to search for some specific tools. And to find that, you simply go to that orange navigation bar, and under resources, go to tools and resources. So one question that every community faces when they're deciding what action to take is what to do, what intervention, which policy, which program is going to be most effective in their community. What Works for Health, as Allie mentioned, is a key tool to help communities answer this question. It is an easy-to-use, searchable menu to help you look for evidence-informed policies and programs. And it's for me, and I think all of our coaches would agree, it's one of our favorite tools to share with communities. So we can find What Works for Health under Roadmaps to Health, and we're going to click into What Works, again on that orange navigation bar. As we come to this, the main page for What Works for Health, I want to point out that on the right, you can see new and updated policies and programs that are new to the site or have just recently been updated. This is constantly being refreshed. Our evidence analysts are always looking at new strategies and updating existing strategies. So notice that is what the most recent or most recently updated policies and programs will be there. And on the left, you can dig into the methodology of What Works for Health by using these items on the left navigation bar. We have 6 ratings in What Works for Health, and you can learn more about those ratings there. And I'm going to show you some other places where you can learn about the 6 different ratings. But let's just imagine that we are a community partnership that's focusing on obesity. And at the table, we have educators and parents. We've got some nonprofits specializing in healthy foods, public health, healthcare practitioners, all working together trying to understand what we can do to improve obesity, specifically childhood obesity. So we can start by clicking on what should be a familiar model. Here, this is based on our model of how we understand health. And we clicked on diet and exercise, and now we see that there are 73 results. So that's still a lot to sift through. How can we further narrow the options or the policies or programs to explore? I want to direct you to the left navigation bar here as you begin to dive into the strategies included in What Works for Health. You can narrow by approach, by decision maker, and by evidence rating. So in our hypothetical example, our goal is to begin to address childhood obesity by providing healthier food options for the kids. So you can narrow your search, and we're going to narrow ours by selecting one of these approaches to increase access to healthy food options. That now brings us down to 26 results to consider. But we also know that we don't have a lot of money for evaluation, and we want to be sure that we're implementing something that's been proven effective in many communities. So we've decided to look first at strategies that have the strongest rating for evidence of effectiveness. I'm going to scroll down here to the evidence rating, and that is those rated scientifically supported. As I click into that, we'll see that that leaves us with 2 strategies to take a look at. 2 strategies that meet this high standard. Now, we already have a school breakfast program, so we're not going to look at that one, but we are interested in maybe thinking about some gardens. So I'm going to click on school fruit and vegetable gardens. which takes us into the full entry. At the top left, you see that thermometer. You may remember it from the slides that Allie presented. And as I hover over that thermometer, I can see the definitions for all 6 of the evidence ratings that we have. And we can see that scientifically supported is up there at the top. And these are strategies that are most likely to make a difference. So as we look at this full entry, we also see the expected beneficial outcomes and other potential outcomes. As we scroll down, you'll see the evidence of effectiveness. This is a really nice summary of basically a lot of what we know about this particular strategy. Does it work especially well in certain populations? Has it been shown to cost X number of dollars, or have this kind of a return on investment? That kind of detail is where you're going to find in the evidence of effectiveness section. As we go down a little further, we'll see the impact on disparities. And then when we can, we include implementation examples and resources, which again, as a coach, I often like to point communities to these implementation examples and resources as great places to pick something up off the shelf and try and figure out how you can make it work in your community. As we scroll down a little further, there's a couple other helpful things in here, and you can also see when it was last updated, so you know just how fresh and how new these are. They are, again, updated on a continuous basis. And you can see related policies and programs. So if the example or if the strategy you're looking at doesn't seem like quite the right fit, you may find related policies and programs to choose from. And the last thing I want to point out in What Works for Health is that this strategy includes a community in action here on the left. This community in action is a story that highlights how Larson Elementary in Harrison, Michigan is implementing this particular strategy. And you can find community in action spotlights sprinkled throughout What Works for Health and the Action Center to help give you some examples of how these strategies and how the key activities look on the ground. And now I'm going to turn it back to Allie to wrap us up.
Great, thanks, Karen. Just want to check in that we are seeing the RWJF Culture of Health Prize.
Yep, I got it.
Great. Thanks for that tour. I always appreciate sitting back and listening and hearing about all of the resources that are available through county health rankings and roadmaps, and would just really encourage our guests today on the webinar that if you do have questions, as I often walk away from webinars and say, oh, I should have asked that question, just to reach out through that Get Help button, and you'll be, as Karen mentioned, put in touch with somebody from our team. I just real quick before we get to question and answers wanted to touch base on the RWJF Culture of Health Prize. Karen mentioned it and showed you where you could find out more about it within our website. I just want to highlight that the Robert Wood Johnson Foundation Culture of Health Prize honors communities whose efforts illustrate an enduring commitment to creating a culture of health for all residents, and winning communities receive a $25,000 cash prize and have their success stories celebrated and shared broadly to inspire locally driven change across the nation. So on this slide you can see the 6 criteria that drive the selection of prize winners, and we're always looking for communities who are bringing these criteria to life. And just to give you an idea of where the RWJF Culture of Health Prize winners are located, here's a map, and you can see that this includes the winners from 2013, 2014, and 2015. And you can meet virtually all of our winning communities and learn about their stories on our website, clicking on RWJF Culture of Health Prize. And for each winner, there's an inspiring video about sort of their efforts that led to their being recognized as a Culture of Health Prize community. And you can also see from this map that there are parts of the U.S. that aren't represented, and we really do encourage applications from all across the country. So definitely take a look at that. The 2016 winners will be announced this fall, and I believe the applications for the next round will be coming out in late August. So now, this is sort of your one-slide warning before we move into questions. Reflecting on everything that you've heard about and learned today, and as you move forward in your own community health improvement journey, working to create health for all, we invite you to focus on the 5 Ds. So first, investigate the difference using digging deeper and other data tools to understand the differences between subgroups. Focus on the drivers that most influence health, policy, systems, and environmental conditions that create opportunities to improve health for all. Dig into the root causes. While all of the health factors affect health outcomes, be sure to focus on the social and economic factors as they contribute the most to poor health. Determine most effective strategies, especially those strategies that, if directed towards those in greatest need, will reduce health disparities. And finally, do it. Harness the collective power of your community to take action that will create more equitable opportunities for good health for everyone in your community. So now we're going to open it up, and I think we're going to turn it over to Erica and see if we have any questions.
Thank you, Allie. We do have a couple of questions, and I think we have a couple of minutes to get to them. So the first question is coming in is, how do I begin conversations about our health findings in our county?
Yeah, great question. Oh, sorry, Karen, were you going to jump in?
Well, why don't you go first, and then I'll add anything to it.
Yeah, so I think, I think back to one of the slides that we shared early on, sort of the logic model and the thinking behind county health rankings. So using the data snapshot as that initial call to action, and then doing sort of a scan of the community and seeing if there's any existing initiatives to partner with and build momentum around would be sort of one of my first starting points. But Karen, I'm curious to hear your response.
Well, I was just going to say that we have a real specific tool for helping you start to share this data, and that's basically it's a user version of our 101. So you can start with the model, that picture of health, and you can start talking about what that looks like in your community, and help them understand sort of what the rankings are, and that they are a starting point for conversations and not like a system, a penalty system, that they are really intended to help start the conversation. So if you go to tools and resources and you look on the left-hand navigation, you'll see where you'll see a category of tools and resources called presentation. And you can download a PowerPoint with speaker notes, with slides that you can use to build your own presentation, and some of the language that you might want to use for talking about this to different audiences and different groups in your community. But so that's a really specific tool. But yeah, I agree with you, Allie, that I think building on what's happening in your community, building on the strengths. We always let people know that no matter what your ranking shows, every community has strengths, and that's one of the great things about being able to highlight those strengths on your snapshot. But building on the strengths, building on the things that are happening already, the momentum that you have going, and pulling that into your messaging so that it's not coming at it from everything is wrong with our community and we don't know what to do. You do know what to do. You do have great resources within your community, and you can really draw on the expertise that you have in your community and the good things that are already going on, and starting and framing your messaging from that point can be really helpful.
And another question that came in is, why are some data reported in percentages and others in numbers? Karen, since you did the website tour, you might want to address that question.
Sure. So we rely on a variety of different data sources to create the rankings. And those different data sources are going to show data differently. The most important thing one of the most important things that we're looking for in data is that it is at the county level. So if you think about what the data is measuring, different measurements are going to lend themselves to a percentage or a rate, and it's really just based on what we're getting from the source, the data source, what we're using.
And that's a great answer, yeah, because some data are presented in rates, and then some are presented in percentages, and we're going to report the way it's presented to us. So, Allie, one participant wants to know, how can we use the website to identify successful interventions?
So I think my mind goes to what works for health as being that starting point, and I really appreciate Karen's walkthrough of that and how to sort of enter what works for health by thinking about what health factor you're looking to impact with your policy, program, or strategy. The other, if you're looking for examples of how communities have successfully implemented an intervention, those stories, as Karen mentioned, that are sort of sprinkled throughout would be a great starting point as well.
Yeah, I agree. One participant wants to know about the variability across counties within a state. So first of all, how can we compare counties, and then again, what can probably account for the variability across the state? So Karen, I'm going to let you address that.
Okay, great. So one thing I want to point out is that when you look at the measure detail page, so I clicked into not childhood, we don't have that. I clicked into adult obesity, and we looked at that measure detail page. I did not click on the data tab, but I mentioned it. If you click on that data tab, you can look at your county's data and all counties' data, so you can really get a sense of what the range is in a community, or excuse me, in a state. And in terms of the cause of those differences, I think the cause of those differences goes to a lot of what the rankings is trying to show, and that is that all kinds of things impact our health. And so the different things that we're looking at, from diet and exercise to education to income, housing and transit, all of those things interact with each other as well. They're not just separate and by themselves. They interact with each other and impact one another. So I think, I don't know that there's an answer to that other than to say that when you see that variability, it points out that there are great differences in where we live and how much of an impact that where we live can have on our health, on different aspects of our health overall. But so I'm not sure. I'm hoping that I'm getting to that answer, or to the heart of that question, and I'll ask my colleagues, Allie and Erica, to chime in, and if you've got other thoughts or reflections on that question.
One thought that comes to mind for me, and this is Erica, is the Health Gaps report, because in some communities that variation may be being caused by disparities, and so I would encourage participants to make sure they look at the Health Gaps report for their state.
Thanks, Erica. Yeah, that is such an important point. That is a really great reference to look at. And again, you can find that in a couple different places, but what I think the easiest place to find it is if you click on your state on the map, and then you scroll down on your state landing page, you'll see where you can open your state Health Gaps report. Great point. Thanks, Erica.
I think we have time for one more question, so I do want to squeeze this one in, and that is we had one participant that's interested in using county health rankings data for advocacy, how could they do that?
So this is Allie, and I guess I'll jump in and say we have a few specific advocacy tools, and not knowing more about what this person is interested in using, I would encourage them to do a search within the Action Center for Advocacy, and the tool that's coming to mind specifically is the, and Karen, you might have to help me out, but Policy Advocacy Choice Tool.
Mm-hmm. Yes,
yeah.
That's it, Allie.
Yeah, so that's a very broad answer. And then I would say it's another opportunity to maybe use the Get Help and get connected with someone on our team to explore what specifically they're trying to capitalize on in their community.
Yeah, I think one of the, if I were just going to direct you to one starting place, it would be in the Action Center, the Act on What's Important step has a lot about basically how do you advocate for change in your community, and I think you may find some really helpful resources there, just generally across the board, about how to develop a persuasive message, how to deliver your message, and some tips in there that you can use. You can apply to the rankings. The other place is Communicate. I think would be another great place to stop in our Communicate step, where you can especially under, and this actually applies to, I think, our very first question, the first activity there is start the conversation, and it's really all about how do you start the conversation using the rankings, because they are intended to be a communication tool. So there's some guidance there, some suggested tools there that can be particularly helpful. But I think it's part of a broader message about who are you trying to influence, and what do they need to hear from you, or what do they need to understand to be able to take the step that you want them to take. And I think that there are a lot of tools in, again, those guides, the Act on What's Important and Communicate guides that can be helpful for using the rankings to help educate people in various positions about what's happening in a community.
So I think that's all the time we have for questions, Allie, if you want to wrap it up.
Allie, are you maybe on mute, do you think?
I think I was. Thank you, Karen. So wanted to point all of our webinar guests to the ability to find future webinars, as well as find the recording from today's webinar. Also, just wanted to highlight there are a number of ways to stay connected with us, so we would encourage our guests to join us on Twitter, Facebook, or sign up for our newsletter. It's a way to stay up to date with all the latest news. And finally, we'd like to, we started with guiding questions, and we'd like to leave you with these two reflection questions. Who else do you need to share this information with? And what's one idea for action that you're taking away from this webinar? And then on behalf of myself and my colleagues, thank you so much for joining us, and there's some contact information if you have any follow-up questions or would like to continue to get in touch with us.